Emily, hey, how are you?
Hey, I'm doing okay. How are you doing?
I am good. One of the hardest things for me about working from home so far has been wanting to snack constantly. So I've had to start like setting
Yes,
an alarm for myself. Like I can't go even into the kitchen again until this alarm goes off because I have two young kids, as you know, and I have lots of good young kid foods. Like I just want to sit and eat Lucky Charms like all day, so I cannot let myself eat or
yeah,
Mateys, the generic brand. So having a hard time with not snacking, I think, has been one of the harder parts about working from home for me.
yeah. I support snacking, so I'm not going to be a real help to you on that.
If my
I
alarm
have
goes off in
secret
the middle of our
snatches.
conversation, I might have to get up and go get a snack so that I can actually.
Good. Then I'll go get myself one of my leftover cookies from the Girl Scouts and join you in
There you
snacking
go.
because
That
I'm
sounds
kind
good.
of preserving those as I
Yes,
go.
very good, very good. So you're obviously with Planned Parenthood. Thank you so much for your organization's endorsement in this race. And could you, just for folks that obviously know, I'm sure everybody knows Planned Parenthood, but they might not know specifically the work that you do as a healthcare provider here in Oregon.
Yeah. So there's a lot of different parts to the Planned Parenthood family here in Oregon, and I am really proud to work at Planned Parenthood Advocates of Oregon and the Planned Parenthood PAC of Oregon. And the Planned Parenthood PAC of Oregon is so excited to endorse you, Shemia. We are just really appreciative of a lot of the work that you've done in the state Senate, on the school board in so many ways. And so I work for the advocacy and the political arm of Planned Parenthood, fighting for our affiliates who provide critical sexual and reproductive health care in the state of Oregon. We represent two affiliates. One of them is called Planned Parenthood Columbia-Willamette, and the other one is Planned Parenthood Southwestern Oregon. And so that for, Oregonians who know us well, those are the health centers in Northeast Portland, Milwaukee, Beaverton, Bend, Salem, Eugene and Springfield, and also Grants Pass, Medford, and Ashland. So we have health centers all across the state in those locations. And even right now, those amazing healthcare providers in the midst of this pandemic are providing the same types of services that are provided all the time. So people can access contraceptive care, all the different types of birth control. We do visits to just check up on your health, your regular annual visit. And our affiliates, PPCW and PPSO, have even moved a lot of those services to telemedicine right now. So people are still getting gender affirming care. We can talk more about this, like all the amazing things that they're doing, just because I'm in awe of the health care providers that work at Planned Parenthood right now. They're just going above and beyond to provide care. But that's a little bit about us, just where we are in the state and the fact that we actually have health centers in all sorts of different parts of the state. We wish they could be in more places, but we provide the critical services of abortion, access to birth control, STI testing, and screening and treatment, gender affirming care, access to PEP and PrEP, and hormone therapy. So all sorts of things provided by our affiliate health centers.
Yeah, when you mentioned birth control, I saw a meme on social media the other day that talked about how somebody's getting ready to go. They're like, oh, I'm preparing for all the baby showers I'm going to go to in December because everyone's going to be home right now. But then saw somebody respond to that and say, oh no, all the babies that are born in this new coronavirus baby boom will all be first children, because anybody who currently has kids right now and are stuck in their homes with them is not a time when we're going to want more kids. And so birth control,
Yeah,
very key at a time like this, when
very
folks are stuck
key.
in their home
Yeah.
with the kids they already have and realizing, oh my gosh, I don't want any more. That was
Yeah.
a well taken point by somebody on social media.
Yeah, my feelings go out to all the parents right now with all the school closures and all the creative things that I'm seeing. And I bet you're doing that with your kids right now, just figuring out how to do spring break in the time of COVID and keeping folks busy when school is closed. It is, I think I always say this to my friends, and I'll say this to you. I know that it's true. Like, you as a parent are a superhero. You are. Parents are superheroes. You do amazing things, and parents are doing amazing things above and beyond right now. I'm in awe.
Yeah, no, there's a lot of people doing a lot of good stuff. And I hope that my biggest hope for parents out there right now is that we give ourselves a lot of grace, because even folks like me, I'm very strict with how much screen time my kids get and stuff. And a lot of that's just going out the window right now. Is it just a matter of a teacher that I actually spoke with earlier, kind of a similar conversation to this. She said, the reality is parents right now need to remember that what kids are going to remember is how this felt. And so if it's stressing out about that's too much screen time, or you need to sit down and do this math or whatever, it's a stressful environment. They're not going to remember the math. They're going to remember how it felt. And that was really great for me. Just be like, oh, like, is this going to be a time that my kids look back on as a time that was fun? Or we go for walks with bubble wands and let the wind blow bubbles around? Or are we going to be like, am I going to be strict about all this time? So that was very helpful. But yeah, I think that it's important. You know, you and I obviously have worked together a long time working on reproductive health and reproductive justice issues. And I know that, you know, folks need to understand the work that Planned Parenthood advocates for, and Planned Parenthood advocates advocate for as a healthcare provider. And obviously our healthcare providers are our frontline workers right now during this COVID-19 crisis. What sort of response has Planned Parenthood generated to the COVID-19 pandemic, and what sort of helpful resources can we provide to Oregonians?
Yeah, thank you. It is such an interesting time right now. So much has changed so rapidly. And to your point about the kids, like, we do need to all take really deep breaths and think about what are the needs of our individual communities, our families, and what can we do to help? And that has been the approach that Planned Parenthood is taking. First of all, I just want to say that everybody who watches this video should go and follow Planned Parenthood Columbia Willamette if you're in the northern part of the state or in Bend, and go follow Planned Parenthood Southwestern Oregon if you're in the southern part of the Rogue Valley, Eugene area. We are putting out updates every day. Our amazing healthcare affiliates are saying when they're open, how you can schedule an appointment, and what kind of services you can get. Just as an example, Planned Parenthood Columbia Willamette is providing drive-up Depo-Provera injections, so allowing patients to remain in their cars and still get care. It's
Birth
pretty
control.
amazing. And yeah, birth control. As per our previous conversation, you can still access birth control even in a global pandemic. This is critical. So our family planning services are still really going. And so the first thing that our health centers and the amazing leadership at our health centers did to respond to this was say, how can we help? And one of the things that we knew we needed to do was to contribute to flattening the curve and being a part of the public health response. So we embraced telemedicine, and we had already been providing telemedicine services already. I bet you tons of folks watching this are like, yeah, I've done a video with my Planned Parenthood provider, or I've been on the phone, or they've helped me get access mailing things. So our folks are doing what the state is doing and saying, like, you know, we all need to be distancing ourselves physically and providing care whenever we can via telemedicine, and then letting the folks who need the most care most immediately go in person to the health centers. And we know that we're contributing by, if you're having, you know, our health centers are like, if you're having really severe pain or bleeding, like, you should still be reaching out and coming into the health centers, and you'll get taken care of. So we've done a lot of things, and I would highlight that, you know, PBCW donated 1,500 swabs, for example, to OHSU so they could continue to provide COVID testing. So we've been partnering with other parts of healthcare to say, how do we help folks who need care but don't need to go to an emergency room or don't need to go to a hospital access the care that they normally would, because reproductive health care and sexual health care doesn't stop. We all still need that even in the midst of this pandemic, but we're trying to do things in our part of the world where we're contributing to limiting the spread of COVID-19, but also just making sure people can access the services that they need.
No, I think that's really important. And you and I were texting the other day about how some states and right-wing states are trying to use this pandemic as an excuse to actually remove people who can get pregnant, remove their right to an abortion, their constitutional right to an abortion. What are you seeing across the country as, unfortunately that's not happening here in Oregon, but what are you seeing across the country as the right to an abortion is under attack, that people are using this crisis as a way to interfere with constitutional rights?
Yeah, Texas and Ohio are some of the states that we've heard examples where they're really throwing into question, is abortion an essential service, or is access to reproductive health care or birth control, like we're talking about, essential? And it's really scary. It's unfortunate that at a time that our communities should be coming together, that, you know, there are folks that are taking advantage of this and making this a political issue when access to healthcare has never been more critical, and the basic needs of folks when it comes to if you want to be pregnant or if you don't want to be pregnant is the question. And, you know, we're making sure in Oregon, and I have to applaud, you know, legislators like yourself and the governor and our Oregon Health Authority for making sure that they've been clear in their guidance. You know, if there could be irreversible harm done to someone, they should still be gaining access to healthcare right now. And also at the same side of the other coin, Planned Parenthood is preserving personal protection equipment like gloves and masks and gowns that are in short supply. So we're obviously doing what everyone in the healthcare community is doing by saying, you know, what can we reschedule or push off, or what can be provided in a different way to preserve PPE, as we call it. But we've seen it in other states, and so we're trying to be vigilant at Planned Parenthood Advocates of Oregon in watching everything that's happening at the state legislature and with the governor as all these announcements are coming out to make sure that no Oregonian loses access to sexual and reproductive health care. And we're seeing our state stand really strong with us, and we really appreciate that. But we have to be vigilant because unfortunately, even right now, we're seeing these attacks in other places.
Oh, it's terrifying. And it's, you know, they're not letting a global crisis go to waste by trying to advance their values of trying to shut down reproductive care and abortion in their states. And so I, first off, appreciate the work that you do. So as you've been on the front lines here, Emily, what's something that you've seen that's inspired you and shown you the resiliency of Oregonians? We don't yet know how much this is going to cost us in terms of our infrastructure, people's jobs. We don't know how long this will take, but what's something that you've seen that showed you that no matter how long this takes, that Oregonians are going to be okay?
Yeah, honestly, there isn't a day that goes by that I'm not inspired by the folks at Planned Parenthood or by my own neighbors and family and community. Like you know, we've talked about this before. I really do see so many silver lining moments right now. Our affiliates, Planned Parenthood Columbia Willamette and Planned Parenthood Southwestern Oregon, have staff coming together and doing everything they possibly can, making sure that if somebody gets sick, they're taken care of, that no matter what happens right now, people are able to come in and get their reproductive health services, and doing little things like checking in with each other about how their family is, and do you have the time to check in on folks, and how are you doing having the kids home with our schools, you know, closed now until the end of April. I think that I'm seeing people act as human beings first before anything else. You know, like often when we're in a work setting, it's like, okay, what do we need to get done? And Planned Parenthood is always a place where our mission shows through day to day. And one of the things that I've heard during this pandemic in the legislature and, you know, on the news is people saying we're in this together. And that's actually a tenet of the Planned Parenthood mission. So it's so funny, like we literally say in this together every day. And so to see all of the different parts of our community say we're in this together is kind of inspiring and probably motivating. And I just have to say, like, seeing the nurses and the different healthcare providers do things like go out to the parking lot and welcome somebody to Planned Parenthood and say, hey, things are a little bit different right now. We have some questions, like, how are you feeling? Have you had a fever recently? And doing all the things that you're supposed to do to keep everybody healthy is also, in a way, as we're like physically distancing, we're actually like closer and checking in with our patients and our staff more. So I don't know. I just think that I'm inspired by the healthcare providers in Planned Parenthood at both of our affiliates. And I just feel lucky to get to work on the political arm and lobby for them and advocate for them and make sure that they can continue to do what they're good at, which is providing really caring, non-judgmental, quality healthcare for people.
That's awesome. And I love, we didn't even plan that, but my what I've taught my kids, when you talk about we're all in this together, what I've taught my kids, we go out for walks, and I've taught them what social distancing is. I've taught them, you know, how far we stay away from people, even if we're walking down the sidewalk. If somebody comes down the sidewalk, that we need to step aside and let them go by so that there's 6 feet in between us. Yeah. But I don't want them to think of social distancing as just this apart thing. So I've taught them, my son is 7.5, my daughter is 3, and you've met them, of course. And I've taught them that whenever I say, hey, social distancing, they know to step aside. And then they say to the person, are you hanging in there? And, you know, they usually respond because my kids are cute. And then my kids will say, we're all in this together. And that's what we say to all of our neighbors who we maybe wouldn't even have talked to before if you just walked by them on the sidewalk. Yeah. Instead, while we're physically distancing ourselves, we're still reaching out to all of our neighbors and saying, are you hanging in there? We're all in this together. And so I just, you know, that's what I've tried to teach my kids, in that connecting with people, even while we're social and physically distancing, we're still kind of looking out for our neighbors and checking in on people. So I love that you're seeing that. That is a silver lining for me. Well, thank you, Emily, for the work that you're doing. I appreciate you being on the front lines, and is absolutely thrilling. And I'm deeply grateful for being endorsed by the Planned Parenthood PAC of Oregon. And as I say to my kids, or as I teach my kids to say to folks, are you hanging in there?
We are hanging in there every day, taking it day by day.
Very good. Well, we're all in this together, and thanks for chatting with me today.
Yes. Yes, we are all in this together. I love that so much. Planned Parenthood staff is so happy to hear that everywhere. So thank you. And thanks for doing this. It's such a great way to connect with Oregonians while we're all at home.
Yes, we are. Thanks, Emily.
Thank you.
Bye.